What to expect in your pregnancy care plan. Your care plan is 100% unique, but this truth is universal. No pregnant mother should be alone with the news of a fetal anomaly. Despite the fact that she did not cause the anomaly and she cannot change what already happened, she will feel like she's carrying a burden that is too heavy without help. Perinatal mental health is a specialized category of mental health available to all women and families navigating conception through postpartum, and we invite you to find a specialist to best support you in this time. Here's a bit on what to expect in your pregnancy care plan. First, a maternal fetal medicine specialist. Once an anomaly is suspected, your OB or OBGYN will refer you to a maternal fetal medicine or MFM specialist. You will also have a conversation with a genetic counselor.
Second, ultrasound and advanced testing. Once an anomaly is suspected, you will undergo detailed ultrasound and probably be presented with additional testing options, such as further specialized imaging, an MRI or an echo, or genetic testing. Let's go over some of those terms. Non-invasive prenatal testing, NIPS or NIPT, also called cell-free fetal DNA, is a genetic test on mother's blood. Therefore, it is not invasive for the fetus, and this can be done as early as 10 weeks. When it is not normal or when a structural anomaly is seen with ultrasound, further testing is usually advised. For instance, high-resolution ultrasound, and this can be done early in pregnancy to visualize some major anomalies, but it is more commonly performed midway through a pregnancy at approximately 20 weeks. By this time, most organs have formed and they are now large enough to be visualized accurately with ultrasound and analyzed for abnormalities. It's the ideal time to see the entire baby all at once. There are two methods of invasive genetic diagnosis. Chorionic villus sampling, abbreviated CVS. This is done between 10 and 13 weeks of pregnancy, and then amniocentesis to obtain fetal cells. And this is typically done after 15 weeks. This can look for genetic abnormalities or infection. And you might also be advised to have a fetal MRI or an echo. A fetal echo examines additional details of the baby's heart or cardiac function. And an MRI can more fully characterize certain anomalies, for instance, the central nervous system.
Third, your fetal care team. You'll be introduced to a fairly large team to support you and your baby. Your MFM or OB will designate referrals to or coordinate care with a team of fetal specialists. In many cases, this lives under the roof of a partnered children's hospital. You'll likely go to another building for fetal care. If you're under the care of a fetal center, expect a team including fetal specialists or pediatric surgeons who may guide prenatal and postnatal therapy or surgery, a neonatologist whose primary focus is your newborn baby and baby's health, your OB or MFM whose primary focus is you, the mother, and your healthcare, a social worker, a nurse navigator or primary nurse managing your appointments, and potentially additional mental health supports.
Fourth, decision-making and counseling. You will be asked to make decisions on fetal care. In addition, you may be offered in-house mental health resources. Related to decision-making, your care team will help you and your family understand what is known and what is unknown about your specific fetal anomaly. What are the possible outcomes and risks? What are your options, including continuing the pregnancy, therapeutic interventions, and palliative care approaches? Throughout this time, you should be supported emotionally and given ample time to ask questions and receive the answers you need.
Can I pause here to make it personal? It's important to note that the overwhelm of information and emotions often leave parents feeling like they retained only a small portion of the information a doctor may have shared. If you need follow-on conversations, this is absolutely normal. You are never a burden to ask more questions of your team or to ask for another appointment. You'll be presented with decision points along your journey. Sometimes decisions need to be made, Other times, you may be able to wait and let the pregnancy take its own course. This can be very difficult. You are not alone, and there are resources to help you find counseling, answers, and support for every unique journey.
Fifth, continued pregnancy monitoring. You will have more frequent ultrasounds to monitor the situation, growth scans, Doppler studies, which are analyzing the blood flow in the placenta to the fetus, monitoring of amniotic fluid levels, and other ways of evaluating placental function and fetal well being. There will be discussion of plans for both when and how the baby should be delivered. At what week is the optimal week? And is it optimal to have a vaginal delivery or a cesarean delivery? And all of these decisions will be based on the relative maternal and fetal levels of risk.
Sixth, some treatment plans will include fetal intervention, otherwise known as therapy or surgery. There are about 50 centers across the country today providing specialized fetal therapy in utero.
Seventh, delivery planning. The delivery location needs to be at a hospital with the neonatal and surgical capabilities that your specific anomaly dictates will be necessary. You and your team will plan for the immediate care that needs to take place after birth or for appropriate palliative care. What is palliative care? Well, it's a very active approach, a whole body care approach for an infant with a life limiting or a very serious condition. And it will focus on the quality of life by managing symptoms like pain, providing emotional and spiritual support for the family, and helping with the decision-making process during pregnancy, birth, and throughout the child's life. Palliative care can be done alongside surgical care, or it can stand alone, depending on the anomaly's severity and your unique circumstances.
Last but not least, number 8 in what to expect, postnatal care and long-term follow-up. After birth, pediatricians, surgeons, therapists, and other specialists will care for the baby. Interventions or therapies may be part of your long-term plan. Support services for you and your family should absolutely be part of your long-term plan as well. Data shows that most perinatal depression and anxiety in fetal center parents appear 10 to 20 weeks after birth or surgery, meaning we must expect and plan for needed support postpartum for 1 to 2 years to come.